Right now, a letter is either sitting in your mailbox or about to arrive, and most people throw it on the counter without reading it carefully. It's called your annual notice of change, and it quietly tells you everything that's about to be different about your Medicare coverage next year. Most people don't open it. Most people just let their current plan roll over automatically, assuming that if it worked fine last year, it'll work fine again. According to the agency that runs Medicare, roughly 7 out of 10 beneficiaries do exactly that every single year, even when a cheaper or better plan is sitting right there waiting for them. Today, I'm going to walk you through the 3 mistakes that quietly cost seniors the most money during this short window every fall, and exactly what to check before the window closes. None of this requires a financial background. It just requires about 20 minutes and knowing what to look for. If you're not subscribed yet, take a moment and do that now and turn on the bell. Medicare rules and plan details change every single year, and almost nobody walks you through what actually changed for your specific situation. That's what this channel is for. Subscribe and let's get into it. Let's start with the basics, so the rest of this makes sense. Medicare's open enrollment period runs from October 15th through December 7th every year. Whatever changes you make during that window take effect January 1st. This is your one guaranteed yearly chance to switch Medicare Advantage plans, switch Part D prescription drug plans, move from Medicare Advantage back to Original Medicare, or move from Original Medicare into a Medicare Advantage plan. Once December 7th passes, most of those doors close until the same window opens again the following fall. There's a second, smaller window worth knowing about too. If you're already enrolled in a Medicare Advantage plan, you get an additional opportunity between January 1st and March 31st to make one more switch, either to a different Medicare Advantage plan or back to Original Medicare. But that window is narrower in what it allows, so the fall window is really where most of the important decisions happen. Now let's get into the first mistake, the one that affects the largest number of people, because it's really a mistake of inaction rather than a mistake of choice. Mistake number 1 is letting your plan automatically renew without reading your annual notice of change. Every single year, your plan provider is required to mail you this notice, usually around September, before open enrollment even begins. It outlines exactly what's changing for the coming year, your premium, your deductible, your copays, which doctors and hospitals are in your network, and which medications are covered. Insurance companies are allowed to adjust all of these details from one year to the next. The plan you have today is not guaranteed to be the same plan in any meaningful sense 12 months from now. Here's why this matters so much. If you do nothing, your plan typically just continues automatically. No one calls you to ask if you're still happy with it. No one flags it for you if your premium went up or your favorite specialist quietly left the network. The system is built to continue by default, not to check in with you. That's exactly why that 7 out of 10 statistic exists. Most people aren't making an informed choice to stay with their current plan. They're simply not making a choice at all, and the default happens automatically in the absence of one. I want to be clear about something. Sometimes your current plan really is still the best option for you, and renewing it is the right call. The mistake isn't staying with your plan. The mistake is staying with it without checking first. Let me make this concrete with a simple, rounded example. Say your Medicare Advantage plan covered a particular specialist last year, and your annual deductible was $400. This year, without you doing anything, that same plan's deductible could rise to $600, and that specialist could quietly drop out of the plan's network. If you don't read the notice, you don't find any of this out until you're sitting in a waiting room being told your specialist isn't covered anymore, or until a bill arrives that's $200 higher than you expected. Both of those situations were entirely avoidable with 20 minutes of reading back in September or October. Mistake number 2 is closely related but specific to prescription drug coverage, and this is the one with the clearest dollar impact backed by research. Research from the Kaiser Family Foundation found that nearly half of all Medicare Part D participants could save hundreds of dollars a year simply by switching to a plan that better matches their actual prescriptions. Here's why this happens. Every Part D plan maintains something called a formulary, which is simply the official list of medications it covers and at what cost tier. These formularies change every single year. A medication that was covered at a low copay last year might get moved to a higher tier this year, or in some cases, dropped from the formulary entirely. This catches people off guard because nothing about their own health changed. They're taking the same medications they were taking last year. But the plan changed underneath them, quietly, and the only way to catch that is to actually pull up this year's formulary and check your specific medications against it, rather than assuming coverage carries over automatically. If you're managing 2 or 3 regular prescriptions, this single check can be the difference between a manageable monthly cost and a genuinely painful one. Here's what that can look like in practice. Imagine you take a medication that cost you $10 a month last year under your plan's lowest cost tier. If that same medication gets reclassified into a higher tier this year, your cost for that one prescription alone could jump to $40 or $50 a month, simply because of a formulary change you were never notified about in plain language. Multiply that across 2 or 3 medications, and you can see how this adds up to real money over the course of a year, all without your health or your prescriptions actually changing at all. Mistake number 3 is focusing only on the monthly premium when comparing plans, instead of looking at the total picture. This is an easy trap to fall into, because the premium is the number that's advertised most prominently, sometimes as low as $0 a month for certain Medicare Advantage plans. But a $0 premium does not mean a $0 plan. It often means the actual cost shows up elsewhere, through a higher deductible, higher copays for specialist visits, a more restrictive network of doctors and hospitals, or a requirement to get prior authorization, meaning advance permission from the insurance company before you can receive certain tests, procedures, or specialist referrals. Here's a simple way to think about it. A plan with a low premium might look great on paper if you rarely visit the doctor and stay healthy all year. But the moment you need a specialist, a procedure, or an unexpected hospital stay, that same plan can end up costing you significantly more out of pocket than a plan with a slightly higher premium and better overall coverage. The premium is one piece of the puzzle, not the whole picture. Looking at your total expected annual cost, premium plus deductible, plus the copays for the kind of care you actually use, gives you a far more honest comparison between plans. Let me walk through a simplified comparison to make this concrete. Imagine Plan A has a $0 monthly premium but a $4,000 out-of-pocket maximum and a restrictive network. Plan B has a $40 monthly premium, which adds up to $480 a year, but a much lower out-of-pocket maximum and a wider network of doctors. If you stay healthy all year, Plan A genuinely saves you money, $480 in fact. But if you have one significant health event, a hospital stay, or a major procedure, Plan A could end up costing you thousands more than Plan B would have, even after accounting for the premium difference. Neither plan is automatically the wrong choice. The mistake is choosing between them based on the premium alone, without thinking through which scenario is more likely for your actual health situation this coming year. Let me give you a few of the actual numbers for this year so you have real context to work with. The standard Medicare Part B premium for 2026 is $202.90 a month. For Part D specifically, out-of-pocket costs are capped at $2,100 for the year, meaning once you've spent that much on covered prescriptions, your costs for the rest of the year drop significantly under most plans. And if you take insulin, that cost is capped at $35 a month under every Part D plan and every Medicare Advantage plan that includes drug coverage, no matter which plan you choose. These numbers matter because they shape what a realistic worst-case scenario actually looks like for your specific situation, rather than just guessing. There's one more thing I want to mention, because it surprises people every single year around this time. Insurance companies are allowed to discontinue plans entirely from one year to the next. If your specific Medicare Advantage plan isn't being offered anymore where you live, you'll receive a notice about it, and you'll need to actively choose a new plan during this same open enrollment window. If you don't make a choice, the default outcome is that you're moved back to original Medicare, which may or may not be what you actually want, depending on your situation. This is exactly the kind of letter that's easy to overlook in a stack of mail, and exactly the kind of letter you cannot afford to set aside this year. Let me clear up a couple of questions I hear often around this time of year. What if you're on original Medicare with a Medigap policy, rather than a Medicare Advantage plan? Open enrollment still matters for your Part D drug plan, since that's purchased separately and still changes every year the same way I described. Your Medigap policy itself generally doesn't change during this specific window, though premiums on Medigap policies can still rise annually, and it's worth knowing that switching Medigap policies later isn't always guaranteed without medical underwriting, depending on your state. A handful of states do offer an annual window allowing existing Medigap holders to switch without medical underwriting, so it's worth checking what protections exist specifically where you live. What if you're genuinely happy with your current plan and don't think anything needs to change? That's completely fine, and you don't need to switch plans just for the sake of switching. But I'd still encourage you to spend the 20 minutes confirming that nothing material changed, rather than assuming it didn't. Confirming you're still in good shape takes far less time than discovering a problem in March. So here's what I want you to actually do, step by step, before December 7th. First, find your annual notice of change, whether it's a physical letter or available through your plan's online account, and actually read it. Look specifically at three things: your premium for next year, your deductible for next year, and any changes to your plan's provider network. Second, pull up this year's drug formulary for your current plan and compare it line by line against your actual current medications. If anything has moved to a higher cost tier or disappeared from the list entirely, that's your signal to start comparing alternatives rather than assuming nothing changed. Third, use the Medicare Plan Finder tool, available directly on medicare.gov. You can enter your zip code, your current medications, and your preferred pharmacy, and it will show you a real cost comparison across the plans available in your area, not just the premium, but an estimate of your total annual cost based on your actual situation. Fourth, if all of this feels like more than you want to take on alone, contact your state health insurance assistance program, often called SHIP. This is a free, unbiased counseling service available in every state, specifically designed to help Medicare beneficiaries compare plans and understand changes, with no sales pressure and no connection to any specific insurance company. You can find your state's SHIP contact information through medicare.gov or by calling 1-800-MEDICARE. Fifth, if your income has changed significantly, whether it went up or down, it's worth checking whether you now qualify for additional assistance programs like the Medicare Savings Program or extra help for prescription costs, which I've covered in more detail in other videos on this channel. Eligibility for these programs is reassessed based on current income, so a change in your circumstances since last year could open up savings you didn't have access to before. Sixth, mark your calendar now, not in late November. The window closes December 7th, and the closer you get to that date, the harder it becomes to get a SHIP counseling appointment or sit down properly with all your paperwork. Treating this as a task for early October, rather than something to squeeze in during the first week of December, gives you far more room to actually compare options thoughtfully instead of rushing a decision under deadline pressure. Here's the honest full picture, one more time. Open enrollment runs from October 15th to December 7th, and changes take effect January 1st. The three mistakes that quietly cost the most money are letting your plan auto-renew without reading what changed, not checking your specific medications against this year's drug formulary, and comparing plans by premium alone instead of total expected annual cost. None of these mistakes happened because someone made a bad decision. They happened because no decision was made at all, and the default option went unchecked. You don't need to overhaul your entire healthcare plan every single year. Sometimes the right answer really is to stay exactly where you are. But that should be a choice you make on purpose, after a quick check, not something that just happens to you while you're focused on everything else going on in your life. A health plan is one of the few financial decisions you get to revisit every single year without any penalty for changing your mind, and that's worth taking advantage of, even if the final answer ends up being, stay exactly where I am. If you know someone on Medicare who tends to let things auto-renew without checking, send them this video before December 7th. 20 minutes of checking now could mean hundreds of dollars saved over the next year, and there's no cost to looking. That's what this channel is here for. I'll see you in the next one.